A very warm welcome to all of you guys. So today we will going to discuss about enterohemorrhagic E. coli. Okay. So in yesterday's video we have talked about ETEC. So today's discussion is all about EHEC. So EHEC is mostly commonly transmitted via undercooked meat, especially undercooked hamburger. Okay. So this EHEC toxin is nothing but a Siga-like toxin. So EHEC toxin produces Siga-like toxin, and the serotype for EHEC is E.Coli 0157H7. So I have talked about serotypes in the very first video of E.Coli, where I have told you that depending on the three type of antigen present O, H and K, we are having different serotypes of the E.Coli, right? And you can remember about hemorrhagic mode of transmission of E.Coli, enterohemorrhagic E.Coli, by simply remembering this thing, that enterohemorrhagic, so it is H and it is transmitted by undercooked hamburger. Okay, so how easy it is. So let's talk about the pathogenesis. So we will going to use this diagram to understand about the pathogenesis. So enterohemorrhagic E. coli is a very virulent bacteria. That means whenever I will told you that any bacteria is a virulent bacteria, make sure that it causes some infection which will be dangerous for the host. Okay, so EHEC is a kind of enterohemorrhagic E. coli. Kind of what? It is enterohemorrhagic E. coli. So enterohemorrhagic E. coli that targets enterocyte of the distal ileum in the colon. Okay, so what is its host cell? Its host cell is enterocyte of the distal ileum in colon. That is the first thing. Okay, and the first step for the pathogenesis of EHEC is the fimbrial attachment. Okay, with the help of fimbriae which are present on the surface of EHEC, they will attach with the enterocyte. Okay, now after that, the second step is translocation of TIR. So what is this? So let me told you that TIR is a translocated intimin receptor, which is a kind of receptor produced by bacteria. That means TIR receptors are expressed by bacteria. Okay, and after that they will translocate those receptors onto the surface of the enterocyte. Now you try to think that what is this? Bacteria is now transferring something to its host. Although the bacteria's natural nature is to take something from the host. So why they are doing this? They are doing this because they want to establish more firm attachment, right? Because try to think about this, when somebody needs something from you and they try to come closer to you, and they will talk with you in such a way that they are very good friends to you, but their actual intention is to take something from you, and that is what is going on in case of EHEC. They will express the TIR and translocates those TIR onto the surface of the enterocyte just because they want more film attachment. Okay, so now this is the second step, that is translocation of TIR. Now in the third step, so it is obvious that as they are transferring TIR for the attachment, that means bacteria should have some plan to interact with those TIR, right? So the plan is the presence of intimin ligand. Bacteria knows that yes, I have intimin ligand, that intimin ligand have the ability to bind with TIR. Okay, and that is our third step, that is known as TIR intimin binding. Okay, so after that the film attachment of the bacteria to the host cell is accomplished. Okay, first they will attach with the help of fimbriae, and after that they will start expressing TIR and translocates those TIR onto the surface of the enterocyte, and then they will attach firmly with those enterocyte with the help of intimin ligand present on their surface. Okay, clear? Now After this attachment, they will start producing a special type of toxin known as Siga-like toxin. Okay, this Siga-like toxin will bind with GB3, GB4 receptor present on the surface of the enterocyte. Okay, then after binding, Shiga toxin gets internalized. Okay, and inside the cell, they will take adenine from 28S ribosomal RNA of 60S subunit and inhibit protein synthesis. Okay, clear? That means what is going on? After film attachment, they will produce Siga-like toxin. Okay, this Siga-like toxin will bind with GB3, GB4 receptor present on the surface of the enterocyte. Okay, after that, those enterocytes gets internalized, right? And inside the cell, they will take our adenine from 28S ribosomal rRNA, okay, and inhibits protein synthesis. Okay, and as protein synthesis is inhibited, it facilitates cell damage and cell death. Okay, and this cell death is the reason of bloody diarrhea. Okay, that ultimately facilitates bloody diarrhea. I think you can understand up to that part, right? That first of all, it will bind to the host cell via fimbriz. Okay, after that, they will translocate the TIR that it expressed. Okay, then they will bind with those TIR via intimin ligand, that is our intimin TIR binding. Then they will start producing Shiga-like toxin. That Shiga-like toxin will bind with the GB3, GB4 receptor present on the surface of the enterocyte, and then they gets internalized. Okay, and then after that, they will take adenine from 28S ribosomal RNA and inhibit protein synthesis. Okay, and causes damages and death of the cell. Okay, which ultimately facilitates bloody diarrhea. I think you can understand up to that part very well, right? Now what will occur after that? After causing the death of the cell, there is a chance that those cell can there is a chance that those bacteria can enter the bloodstream. Okay, and if they can enter the bloodstream, then the onset of bacteremia is established. Okay, and if they starts multiplying in the bloodstream, then the condition moves to more dangerous situation known as septicemia. Okay, now from the circulation, it can transfer to various organs. Okay, and causing various kinds of destruction. We will going to talk about this. So if they can reach RBCs, they can, although RBCs are already present in circulation, so they can cause destruction of the RBC, causing hemolytic anemia. Okay, then they can also go to kidneys. Okay, and in the kidney, they causes damages in the microvasculature. Okay, this microvasculature damaging leads to hemolytic uremic syndrome, which is a very important condition in kidney. This hemolytic uremic syndrome occur when small blood vessels in the kidney become damaged and inflamed. Okay, under such circumstances, clots are formed in the blood vessels. Okay, which causes problem in the normal filtering system of the kidney. Okay, and as a result, the kidney failure will occur. Okay, so this is the hemolytic uremic syndrome that can be facilitated by Shiga-like toxins that is produced by EHEC. So another thing I have forgotten to mention here, that EHEC producing Shiga-like toxin, and Shiga-like toxins meaning that these toxins produced by EHEC have the same mode of action that the toxin produced by Shigella dysentery follows. Okay, that is why the name Shiga-like toxin. That means the mode of action that you are learning here will help you to understand the Shigella toxin also. So now after that, we have talked about what is going on in kidney, and we have talked about what is going on in RBC, right? So now after that, let's talk about what cigatoxin doing in platelets. So first of all, cigatoxin activates platelet and brings about thrombocytopenia. Okay, and they can also causes activation of the clotting system or a cascade which ultimately facilitate disseminated intravascular coagulation. Okay, and platelet can also being activated makes them stick together to form platelet thrombi, which is a situation especially occurring in renal vasculature. Okay, and which ultimately facilitates cutting off of the blood supply to the kidney, which ultimately brings about acute renal failure. Okay, so that is the thing that platelet doing. So if you are having difficulties with remembering the situations, then I would like to recommend you that just remember about that in the cigatoxin by activating platelet causes thrombocytopenia, activation of the blood clotting system, or cascade to cause disseminated intravascular coagulation or DIC. Okay, and platelet can also cause platelet thrombi in the renal vasculature that ultimately cuts off the blood supply in the kidney. Okay, that is how they mainly causes acute renal failure. So E.Coli 015787 is the main cause of acute renal failure in children and has a mortality rate of 3 to 5%. Okay, and many of them who survives are end up with having permanent kidney damage. Okay, so in the RBC they are causing hemolytic anemia. In the kidney they are causing hemolytic uremic syndrome. In the platelet they are causing thrombocytopenia or disseminated intravascular coagulation or activation of the blood clotting system or platelet thrombi that ultimately facilitates acute renal failure if this platelet thrombi is formed in the renal vasculature. Okay, so and in the brain they causes microthrombi. This microthrombi ultimately clots off the blood supply in the brain, which causes various neurological manifestations like stroke, seizures, coma, hemiparesis. So hemiparesis is the weakness of the muscles of patients in both left or right side of the body. So that what they are doing if they get entry into the circulation. In the RBC they are causing hemolytic anemia. In the kidney they are causing hemolytic uremic syndrome. In the platelet they are causing platelet thrombi or thrombocytopenia. Okay, so we have talked about RBC, we have talked about kidney, we have talked about platelet, and in the brain they are causing microthrombi, which ultimately facilitates various neurological manifestations such as seizure, coma, stroke, hemiparesis. Okay, which is nothing but the weakness of the patient's muscle in both right or left side of the body. Okay, so that is all about the pathogenesis. I hope you have learned it very well. Then let's talk about how you can diagnose your E.Coli 015787 serotype. So you can use sorbitol containing McConkey agar. Okay, because this E.Coli 015787, remember, is non-fermenter of sorbitol. It cannot ferment sorbitol. Okay, and I have told you that in McConkey agar the cells who are non-fermenter appears colorless, right? So that is why they will appear colorless colonies in the sorbitol containing McConkey agar. So remember it very carefully that in diagnosis of E.Coli 015787 we are using sorbitol containing McConkey agar, not normal McConkey agar. Okay, and then those colorless colonies can be screened for 0157 antigen. You can do this by normal screening techniques that are available, and serotyping can also be done for the O and H antisera. We will not apply K here because we know that the serotype here is E.Coli 015787, so we will look for O and H antigen, right? And in septicemia we can do blood culture, because I have told you that in the blood vessel when bacteria is present are called, in the circulation when bacteria are present are called bacteremia, and when they are multiplying inside those blood circulation, septicemia occurs, right? So we can do blood culture to find out whether bacteria present or not. We can also detect those enterotoxin by ELISA or other immunological method, and for detection of the verotoxin or necrotoxin we can take the help of verocell assay. Okay, so that is how you can diagnose your E. coli 0157H7. First one is the sorbitol containing McConkey agar, okay, that gives you colorless colony. Now by taking those colorless colonies you can screen for the presence of O and H antigen and the serotype of the O antigen, that is O157. You can also do a blood culture if you are suspecting that your patient's Shiga toxin already enters the blood circulation. Enterotoxins can be detected by ELISA or other immunoassay techniques, and verotoxins or necrotoxin can be detected by verocell assay. Okay, so that was the lecture for E. coli 0157H7. So we have talked about the major two, EHEC and ETEC, right? Now we will talk about the pathogenic strains which are not that much important, that is EPEC, AIEC, EAEC, but also we will going to talk about this. So okay, thank you.